Hello, everyone. Thank you so much for joining us today. Welcome to another episode of North Star Presents. My name is Savanna, Marketing Director with North Star Senior Advisors and North Star Cares. And a little bit of background about North Star, both North Stars. So we provide a senior placement service, a complimentary service to help seniors and families locate senior living options in the Central Florida area, as well as care management with our wonderful care management team. And so today I have with me here Brenda Lyle, one of our awesome care managers. So she's going to talk to us today a little bit about the differences of a care manager, private duty home care, as well as home health care. November happens to be National Home Care Month, and we also get asked a lot, what is the differences between those three? Because they are a little bit similar in some ways, but definitely a lot of differences. So we thought it'd be very fitting and very important to talk to you all about today. Brenda, thank you so much for joining us today. We really appreciate it. Before we begin, tell us a little bit about yourself and what a care manager is.
Okay, so thanks, Savannah, for having me. I love doing these informative videos for our families. A little bit about myself. I actually started out in this industry as a private duty caregiver about 20 some odd years ago, a little more than 20 years. And I worked my way. I literally worked my way through the industry. So in 2016 is when I really decided that I needed to stick with care management specifically. And what I learned over the course of those years is that there are a lot of facets to the senior care industry, but care management and being a care manager gave me access to help the seniors and their families in the broadest ways possible. And I will share those ways with you when we talk about care management, but that is what attracted me to the care management industry. So I have been doing private care management for about 4 years now.
Wow, that is amazing. And I mean, we really appreciate that service. It's so needed. We have so many families that need help, assistance. Their family members are far away. They have no one there to kind of coordinate all the financial pieces, legal pieces. So, what you offer is very helpful. We really appreciate that. But so tell us a little bit about the differences between care management, private duty, and home health care services.
Right, and that's where actually a lot of confusion starts because home health is a very broad category. So home health actually includes any healthcare services that are delivered in the home. Now, home is defined by where you live. So you actually find home health in multiple places depending on where you live. Home health may be delivered in your own private home, in your assisted living apartment, or even in a nursing home. So the big distinguishing factors between the three segments of home health, which is what we call skilled home health, and those are the services that are provided between PT, so that's physical therapy, occupational therapy, speech therapy, as well as some nursing home services. That is one segment. Private duty is another segment within the home health umbrella, and that includes private caregivers that often do things like what we call activities of daily living. They help the seniors with their ADLs. Those are things like bathing, dressing, grooming, as well as instrumental activities of daily living like shopping and handling, maybe bill paying. Now, care management, what we do that's a little different is that basically we oversee those moving parts. So as a care manager, I may hire a home health company that includes a physical therapist and an occupational therapist and a nurse to provide those therapies to the seniors wherever they call home. I might also hire a private duty company to help the seniors with other things they need, or care management goes a little bit further because we also help seniors and their families hire financial planners, elder care attorneys. We may assist them with their doctor's appointments or even finding a new physician. So care management actually oversees the other two moving parts of the senior care industry. And the other important difference, and everybody always wants to know, is who pays for what.
Mm-hmm,
So
definitely.
skilled care, which is home health, is paid for by Medicare. But
Okay.
the other two things, the private duty care and care management, can be paid for by long-term care insurance, as well as some other benefits that seniors may be entitled to depending on their specific financial situation.
Got it. So you kind of tie in everything together. You can help hire the home health care and the private duty. So,
Exactly. And that's what makes care management a valuable resource for families that live far away, because clearly they're not here to walk their loved one through the day-to-day things that they might need help with. They don't know the local resources and they're not always available. So that's why care management becomes a very invaluable service to the seniors and their families.
I agree. And it's not always a known service. So it's so important. I love doing these videos too to educate our families that this service is out there for them. Because again, it is super valuable when you're not there. You know, it's nice having that one point of contact to call to make sure everything's going well and everybody stays organized.
Right.
So I love it. Well, thank you so much for your time and explaining this. It's definitely an important topic. So I appreciate it. Thank you for all that you do for seniors as well.
I can speak on behalf of all care managers. We all love our job. So thank you for appreciating what we do.
Of course. Thank you so much and take care. Also, before I do wrap it up, if someone wanted to reach out to us for care management, we're going to leave our information down below. Definitely give us a call. Brenda would be happy to assist you and all of your care management needs.
Thank you, Savanna.
Thank you.